Hi everyone. Welcome to RSB Healthcare Consulting. 5 considerations when texting patients. Even if your healthcare practice has a highly limited relationship with health text messages, either because it's prohibited or only used for patient reminders and alerts, it's worth revisiting what is and isn't okay when it comes to texting among doctors, patients, and staff. Keep the following tips in mind whenever you unlock your smartphone to ping someone in your medical practice's orbit. Don't forget about HIPAA texting rules. The HIPAA/high-tech privacy and security rules cover any communications with electronic protected health information, IFI, including email, social media, and text messaging. Violations can earn you fines of up to $50,000. Health text messages without PHI, however, are permitted under HIPAA texting guidelines, even if they mention a patient's name. Understand your risks. Stay mindful that even non-traditional privacy violations related to texting can put your practice in hot water over HIPAA. After learning doctors at a nursing home had been requesting patient information be sent via text, the CMS intervened with a 10-point remediation plan that required the facility to retrain staff, appoint a HIPAA security officer, and revise its policies and procedures. Notably, they saddled the organization with the compliance program even without evidence that the PHI-loaded messages had ever been viewed by an unauthorized party. The lesson: lock up your texting now, since you don't even have to get caught to get in trouble. Be proactive on data security. If communicating PHI via text is vitally important to your practice, due to reasons related to geography, convenience, accessibility, or anything else, then you need to go about it with an eye for hyper-vigilant HIPAA compliance. Contract with a healthcare-specific texting service. More on these platforms in a moment, making certain that their offering meets HIPAA's minimum requirements, including a high level of physical security, controls, and ongoing risk assessments for the service's on-site or off-site data center. Encryption of PHI in both in-transit and at-rest states of communication. Authentication of intended recipient's receipt. Controls enabling all messaging activity to be recorded and/or audited. Remember to ask for consent when it comes to texting medical information to patients. You must have their consent first and foremost. Failing to ask consent will place you in strict violation of the Telephone Consumer Protection Act, TCPA, which can carry serious fines for those who fail to comply. Patients cannot verbally consent for you to begin texting patient information to them. Your healthcare practice must have written consent from any patient before messaging begins. Whether through a paper or electronic form, your patients must put it in writing that they consent to text messaging from your health practice. Think beyond patient health. Don't forget to stay diligent about all texting communications among your doctors and staff, even those that have nothing to do with patient health. Text messages are highly vulnerable to hacks, data breaches, and plain old prying eyes, making common sense caution a huge priority. Instruct your team to never share medical billing details, patient identifiers, or any financial information via SMS. If they do, they're simply putting the financial health of your practice management, and your patients, at risk. Thank you for your time. Contact us to collaborate on our email info@rsbhealthcareconsulting.com or our website www.rsbhealthcareconsulting.com.